to distinguish between when we're looking at on the group level and in the individual. I think when we're looking at group or cohorts, we're pretty good at using biomarkers such as MRI, lesion load, or quantitative measures such as brain volume, or even things like magnetization transfer or short T2 measures, like relaxation time measures, to look at natural course, natural history, as well as interventions. The problem always arises is what you do in the individual, and I think this is still the big challenge. I think what will help further there is assistance by AI, so artificial intelligence. And so just as an example, we've just been awarded a grant together with an industry partner to look at the use of assistive technology of this type in our multidisciplinary team meetings. So where we're making decisions about individual cases and individual patients and their further treatment, and whether or not the assistance of AI will help in that decision-making process. So we're getting closer, I think, to using these technologies for individual prognostication. The other, I think, big element that people are discussing is obviously neurofilament testing. So we've been using this over years in the spinal fluid. So that's always, it's one of the standard tests we do at the beginning of the disease when we make the diagnosis. But we've also been using it quite a bit in patients where there's uncertainty whether there's still ongoing inflammatory activity despite the MRI not revealing change. And it's interesting that we do pick out quite a few people that have an elevated level of neurofilament light chain who have no changes on MRI. On occasion, you also find the reverse, but generally speaking, neurofilament level seems to be a little more sensitive. Again, can that be translated into clinical practice? I think we're relatively close to that. There's been a very large study led by a group in Switzerland, in Basel, recently, that also provide an online tool to essentially compare your own serum neurofilament level with an age-matched control population. And I think it's quite good because this will give people the opportunity to start testing this, using this, and then start looking how to incorporate that into their treatment algorithm.